We are honored to be joined by our longtime friend, Dr. John Bonamo, who is Executive Vice President and Chief Medical and Quality Officer, RWJBarnabas Health. Jack, good to see you.
Good to see you, Steve.
Let me ask you this, Doctor. We're taping in September. Things are moving very quickly with COVID, with the Delta variant, et cetera, et cetera. Impossible to predict, but let me ask you this. Your organization has decided to mandate vaccines. A, why? B, what do you believe the impact of that will be?
So the why is pretty easy. People who come to us are already compromised in different ways, and we have to be a clean source for them. They can't come to us and think, well, I'm here for some other illness, but I could also get COVID from these people who are working with me in an intimate fashion. So we believe it is really essential that the healthcare workers protect themselves, their families, and their patients. And so we think there's really not an option here.
Let's talk boosters. As we speak, literally just taking my mom to get the booster as we're talking right now. And right the day before, she heard something on the news, and she calls me, is this the right thing to do? And it's not about my mom, it's about millions of people out there who have questions. As of right now, what do we know about and there are different boosters, the Moderna booster, the Pfizer booster, J&J, et cetera. What do we know about it and what don't we know, Jack? By the way, I call him Jack, a longtime friend. Dr. Bonamo goes by Jack. I'm sorry, Doctor.
No, pleasure. I'm Jack. The booster has been a little bit confusing, or maybe a lot confusing for the general public, in that the White House really said something and then the FDA said something else. The White House said, yes, we're going to say as of next week, everybody's getting them, but then the FDA did not come out and say that. What they have said thus far is that people who are immunocompromised should get booster shots. Those are people who have cancer, who are being treated for cancer, have recently been treated for cancer, have some other defect in their immune system, people on chronic steroids for different diseases that depresses their immune system. So patients who fall into those 4 or 5 buckets all around compromised immune system, they should get the shot now. They should get it because if they were to get a breakthrough infection, that is an infection of someone who has already been vaccinated, again, they would be much more vulnerable. And so that is the group that is currently being vaccinated with the 3rd shot.
By the way, we often put the date up that we're taping because we're trying to communicate clearly that while we are not the news, check out NJ PBS, our news program, Spotlight News, and also Metro Focus for day-to-day events. However, because this is a moving target, and Dr. Bonamo talks about what the White House says, what the CDC says, here's the larger question. That's our role, is to try to take a bigger picture look. Jack, why is it so, I'll ask you this way, why is it so difficult for the White House, for the CDC, for public health professionals, for our individual physician we go to be on the same page? Is it harder than a layperson like me thinks?
Yeah, it is, because this is unprecedented in regard to, first of all, we've never had anything of this magnitude, of this severity, and we've never had a medical issue like this that has been so politicized. And so now there are so many people who make decisions and filter what they hear in regard to the medical evidence through a political lens. And that doesn't get us to any place good. That has gotten us to kind of where we are, with different camps believing, because I live in that camp and I believe in the ideology of that camp, I'm going to follow them medically, even though they're not. That's not what they're about. And so that's really very new for us, and has caused a lot of problems in a pandemic of this size. That having been said, New Jersey has really done a good job. We are one of the most vaccinated states. We're probably number 5 or 6 best states in regard to percentage of people vaccinated.
But not where we need to be, right, Doctor?
We are not where we need to be, for sure, because in the last week, we were one of the top 3 largest increase in patients with COVID. And
as we tape this program, we went backwards. Is that correct, Doctor?
Yes, yes. And so, we could say some great things about today and yesterday. That we're the fifth or sixth best vaccinated state. Last week we had the 39th lowest death rate from COVID in the country in our state. However, also last week we started to increase to the point where we have the third largest increase. So we can't rest on the laurels of we did okay. We're not done. We're not done by any means.
A big picture question. By the way, RWJBarnabas Health is a supporter of public broadcasting and an underwriter of ours. Doctor, long term, beyond the new information that's coming out every day, every week, the statistics, trying to follow the science, if you will, what do you believe, big picture, the long-term impact on the healthcare system will be because of this pandemic?
So already there have been significant changes in the way we do business. And when we started the pandemic, our medical group, which is a very large medical group, really were not doing televisits, telehealth visits. By 1 month into the pandemic, they were doing 20,000 telehealth visits a week in our system. And that has not gone away now, even though people are coming back to their doctor's offices. Significant amount of the medicine being delivered is being delivered through an electronic methodology. We also learned to work somewhat better as teams. Medicine is very hierarchical, and that's a problem. That's one of the reasons errors occur in medicine, because people are afraid to speak to power, and there's a power distance between different people in the healthcare team. So much of that went away during COVID, and people learned to work as teams in ways that they never had before. And we've seen that continue. We've also seen people practicing at the top of their license in a way they had not before. We had nurse practitioners and other advanced practice professionals who probably were doing less than they could have done in the medical arena, but the urgency and the overwhelming volumes allowed those people to step up and work at the top of their license, and that won't change now.
I wish we had more time, Dr. Bonamo. We'll continue this conversation with you and your other colleagues, and I would be remiss if I did not say on behalf of everyone in the public television family, thank you to you and your colleagues, and to all the hospital and hospital systems, the frontline workers, the doctors, the nurses, the respiratory therapists. We cannot imagine what you've been going through up to this point and what you're going to continue to face. So thank you, Jack.
Thank you, Steve. Appreciate it.
We appreciate you and everything that you and your colleagues do. I'm Steve Adubato. We thank you so much for watching, and we'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, TD Bank, the Northward Center, NJ Best, Johnson & Johnson, the Healthcare Foundation of New Jersey, United Airlines, PSC&G, and by Community Food Bank of New Jersey. Promotional support provided by NJ.com and by the New Jersey Business and Industry Association.
Every day, nearly 2 million customers across New Jersey rely on PSC&G to provide natural gas. And every day, PSC&G is committed to doing it safely. That includes making sure you know what to do if you smell gas. A natural gas leak smells like rotten eggs. If you suspect a gas leak, leave your home immediately. Get far away, then call 911. Remember, smell, leave, call. Protect the ones you love. Learn more at pscg.com/gas safety.